Good evening, everyone, and welcome to tonight's Doctors on Call session, SGU OBGYN. My name is Erin Skelly. I am an Assistant Director of Admissions with the SGU School of Medicine, and I'm here to welcome you to tonight's session. We're going to get started in just a few minutes. I'm not actually going to be hosting tonight's session. We will be joined by my colleague, Joe Franza, an Associate Director of Admissions, as well as three graduate panelists who attended our program and who are all practicing OBGYNs now. So before we get started, I want to do a little bit of housekeeping. For those of you on our Zoom session, I wanted to encourage you to open up the question and answer box. We're going to be utilizing that feature during today's session so that we can answer your questions in real time. So if you just want to pop that open and to give it a go, why don't you just let us know where you're calling in and joining us from today. We'd love to hear where you are right now. And for those of you who are joining us on Facebook, you can open up the comment section and you can let us know there if you have any questions. We'll try to answer those live. And also let us know where you're joining us from today. We have someone from Kentucky, which is awesome. Welcome. I'm actually your local rep. I recruit in Kentucky, West Virginia, Virginia, and Maryland. So it's nice to see someone from my region here. We've got a couple of folks from California. So welcome to all of you on the West Coast. Again, for those of you who are just joining us today, we're going to get started in just a minute. But before we do, I'd encourage you to open up the question and answer, that Q&A box, and let us know where you're joining us today. We're going to be using that also to answer your questions live during our session. So once we get started, please feel free to use that Q&A box to send us your questions, and we might even answer your question on the air. So we're really excited to have you here this evening. Okay, and I think it's a little bit after 8 o'clock, so I think we are ready to get started. I'm going to hand things over to my colleague, Joe, and he's going to start off tonight's presentation. Enjoy.
Thanks so much, Erin. Appreciate it. So we have some great guests on here already. I'm so excited. I saw, West Africa. I saw a few from California. So welcome from all over. As Erin had already mentioned, we are live streaming on Facebook, YouTube. So thank you all for joining us that are, out that way as well. I saw on our Facebook page, there was someone from Toronto. Please, continue to send questions, say hello to us as we go through tonight's presentation. We have three amazing panelists that will be talking to you throughout the night relative to their profession, OBGYN. And we're really excited to welcome them and welcome all of you as we, navigate through tonight's amazing conversation. I see that we have someone from Rhode Island, a few from Canada. So fantastic. Glad we have a few Canadians here joining us. Miami, awesome. We have one of our panelists tonight is currently in Florida. So you got Zimbabwe, awesome. Fantastic. Another California. This is great. I'm excited. I myself, I see Ashley is from New York. I myself am also from New York. I've been with St. George's University for over 8 years now. And a big part of my heart is St. George's University. And a big reason why I'm so passionate about SGU is the family-oriented environment. And the major network that they have here at SGU. And we're going to talk through some of those things as the presentation goes on. But I just warn you, if it seems like I am screaming at you, I promise you, I am not. It's just that I am excited. I love what I do. And I am happy to be here with these amazing panelists that are on here tonight to talk through this amazing journey. And hopefully some of you might be interested in OBGYN in the future. Maybe these amazing panelists can be a resource for you or a mentor for you in the future, which is what it's all about. So without further ado, I want to kind of turn to our panelists here to get a little bit of their backgrounds. If you wouldn't mind, I'm going to start with Shada. Shada was a 2020 graduate, so she's one of our most recent class, and very soon she'll be a full year done with residency, and there'll be a whole new class. So she won't have to hear that anymore, at least from me or anyone else that when she comes on these presentations. But Shada, if you wouldn't mind just doing a quick introduction of yourself and where you are currently.
Thanks, Joe. So hi guys, I'm Shada. I'm a first year OBGYN resident in New Jersey. I'm originally from the Midwest, Kansas City to be exact. And I did my clinical rotations out on the East Coast. And then that's how I stayed here for residency.
Thanks so much, Shada. I appreciate it. All right, let's turn to Pauline. Pauline, if you wouldn't mind, just a quick introduction.
Sure. So I'm a current PGY3, so I'm a third year, and I'm going to be chief next year at my program at New Jersey. I'm originally from California, but I kind of like Shada, I did my clinical rotations in the Northeast, so that's how I ended up here. And hopefully I'm pursuing a job searching soon.
Awesome. Thanks, Pauline. And I'm sure with the nice chief resident tag that will only help benefit you as you make your way forward towards the next steps in your future. But congratulations on receiving that honor as it starts over and as things turn over in the next year. So congrats on that, Pauline. All right. And last but certainly not least, Chima, introduction for yourself as well.
Hi guys, my name's Chima. I am SGU grad of 2014. And I am a second year fellow now at University of Miami Jackson Memorial Hospital in Florida. I guess with regards to where I'm from, convoluted question. Born and raised in Nigeria, but been everywhere. Most recent place I called home before coming here was New York. So nice to meet you guys or chat with you guys today.
Thank you so much, Chima. I appreciate it. So obviously you can hear we have some great panelists that are ready to go and ready to answer all of your questions. So as Aaron had mentioned before, please feel free to send messages and questions to our Q&A box if you're here in Zoom. For those of you that are on our Facebook page or on YouTube, feel free to let us know if you have questions on those platforms. We are going to try to answer all of your questions throughout this evening. So I want to start off with the big question I'm going to start with Shada. Shada, if you don't mind, what led you to OBGYN?
Yeah, so it was something I was always interested in. And then it actually happened to be my first rotation as a third year. And I remember just thinking it was so fun how, obviously like delivering babies was fun, but just all the different things that you did. It's clinical, it's medicine, it's surgical. It's very hands-on, but then you still have the continuity of care. So that's what initially attracted me to the field.
Awesome. Thank you so much. I'm going to ask the same question of you, Pauline, if you don't mind. What led you to OBGYN?
So I was a little bit different. I actually came into SGU thinking I would pursue a career in pediatrics. And OBGYN was actually my last rotation in third year, and everything kind of changed for me. I fell in love with it right away. I found that I had a knack for doing procedures. I loved being the OR, which was surprising for me. And I just really enjoyed kind of the fast-paced lifestyle. L&D can be really unpredictable. It can be quiet at one moment, and then the next thing you're like on your feet, you're running. Kind of go to do a stat C-section or something. So you're always on your toes. So OBGYN is just like a great mix of like, as Shada said, like clinical, surgical. And I just feel like there's no relationship that you can really compare between a patient and their OBGYN. That's like irreplaceable. So just having that mix was just, it was perfect for me.
Awesome. Thanks, Pauline. Yeah, I think that's a really good point. And I like that. I like that mix piece of it all. So I want to just add and ask the same question to Chima. Chima, if you don't mind, what led you to OBGYN?
Mine's a corny story to say the least. So when I first moved to this country, there's a TV show, I don't know if it's still on, I haven't watched in a while, A Baby Story on TLC. Quite hooked on that. My mom, I think, had other thoughts on why I liked that show. I just always thought like being a part of bringing birth to the world or bringing birth to life really is like a blessing. We don't necessarily have any control over it. We're just in awe to be a part of it. And a lot of times in OB, you feel, yeah, you went through medical school, did all this learning or whatever, and you know what to do. But 9 times out of 10, as a person of faith, I feel we're just guests at this miracle that we get to experience every single day that not every specialty gets to do. I did dabble in general surgery for a hot second. I thought it was something that I could do, I could master this, but the personality didn't fit. And internal medicine was a little too slow paced for me. Like Pauline said, it's very dynamic, it's very quick and go. 1 minute, nothing's happening. Next minute, it's a stat everywhere you turn. So that ended up pretty much being my second love, I guess.
I love it. Yeah. And I think there is a really unique and niche area here that you get to be a part of some miracles for sure. That's a really cool part of the job. So let's kind of dive right in here. So obviously a big part of getting yourself ready, when we do our presentations, typically we talk a lot about being able to obtain that residency position and being able to have the success that you have all had. Last year we matched over 1,100 students into U.S. residency positions. Shada was part of that big number. And that was the most that any medical school has matched into a U.S. residency year. So we were, so proud of all of our alumni and all the things that they represent. And a big part of that is just making sure that they have the foundation to get there. So what I want to talk about now is kind of how SGU's curriculum helped to set you up for not only residency, but clinical rotations as well. Chima, if you wouldn't mind, I'm going to start with you here. Would you mind kind of talking to your experience relative to the curriculum and how it helped to prepare you for the STEP exam and beyond?
Sure. So St. George's is no ordinary medical school, and I don't say that lightly just because I have friends who went to U.S. medical schools, and we're discussing that prior. The curriculum you go through is the same as you would any medical school, but SGU definitely goes over and beyond to make sure that you actually understand what it is that is being taught, you actually know it and can implement it to patient care. So it's not just a question of just taking your classes and quote unquote passing them, the clinical part is also incorporated into that. And there's high bars set for you, like my mom would always joke, a C doctor is still a doctor. I don't think SGU goes by that MO. They want you to be the best that you can be before you come out, because at the end of the day, you're a representation of the institution you trained in. And yes, we do have a higher bar to follow, so to speak, because at the end of the day, we're still a foreign medical school. But that is the reason why everyone who comes out of there goes out of their way to prove a point to show that, look, we are equal, if not better, to the students who train at U.S. medical schools. At the time I went to SGU, we had, I don't know if it's still this way because it's been a while, 2 years of class blocks like basic sciences on the island, and then the remaining 2 years in the United States, wherever you decide to go to for your clinical rotation. And those are pretty well structured in terms of where you were placed. You decided where you wanted to go on the island before you left, and then they plugged you into where you wanted to go. And 9 times out of 10, people got where they wanted. I've never been to New York before. All my friends would go to New York. I was like, hey, what the hell, I'll try it. And I got New York and I ended up here. Before Miami. And the hospitals you get into, I was fortunate enough to train in a HHC hospital in New York. And I know they do have, their, what's the word I'm looking for, what they're known for. But the good thing about HHCs, at least when I did it, it was a lot of hands-on for our students. Like we were allowed to do quite a bit. Medical education is not a spectator sport. You have to be involved. So if you're not that student who's going to have your way to be a keener, as the term my Canadian friends used to call those who were a little too eager to want to get an IV done or to get an A-line or whatever, you won't learn anything. But somehow it was so ingrained in us from the island coming out, you can almost tell an SGU person apart from a US grad, because we're the ones who are at the forefront. Like, what do you need us to do? You be that student that has pockets of supplies already packed, ready to go for any procedure because you don't want to be left behind. Those are the kind of people that you would have as colleagues if you end up going to SGU, essentially. I made a lot of friends there that I didn't think would be lifelong friends that ended up being that way. We still talk on WhatsApp now, like a whole group thing. And somehow we ended up with all the specialties needed. So now that everyone is all grown and having kids, we have different people to refer whoever to within the group. So it's like it was a cool experience. I wouldn't change it for anything.
I love that. Thank you, Chima. Yeah, it's so interesting to hear the perspectives and hear so many stories like the one you just mentioned relative to your group of study, fellow colleagues that now are all in different specialties, and now you have some people to reference. It really is amazing to get to know all these different individuals when you have such a large network, over 18,000 graduates that have graduated from St. George's University. That's a huge network that you're involving yourself in as you get, onto the next step and into this area. And then also you have this great support group to rely on through each and every step of the way, which is a big part of making sure that you can put yourself in the best position possible. Pauline, I want to direct the same question your way as well. As you went through, Chima talked a lot about the entire process as a whole, relative to the way it breaks down: first 2 years, basic sciences, last 2 years, clinical rotations. How did you feel SGU helped to prepare you for, the step one and then beyond that to help obtain that residency or choice?
I mean, just want to reiterate that SGU really does prepare you for your exams. I think that the way basic sciences is set up really kind of drills in the basic knowledge that you need to pass the exam. And because that bar is set so high, when you do go into clinical rotations, you are, at least where I was, kind of intermixed with the US med school. And we do, even though we were international grad at SGU, you could tell the difference. Like, we are definitely a little bit more gung-ho because you want to stand out, like we are a foreign graduate, or we will be a foreign graduate. So you kind of have that fire behind you, is like, hey, I want to get more involved. And you want to not show off, but you tend to you study a little bit harder, and you tend to want to volunteer to do more things. And it's not just like me. I just noticed that about all the SGU students. And you're kind of almost, by going to SGU, you kind of join this, not a secret club, but a club nonetheless, that no matter who you run into, even today, I ran into an IM resident who also went to SGU, and then we both found out we were SGU, and then we just had that camaraderie, hey, we all went to the island and we stuck through and we made it. So that network, and no matter who you meet from SGU, you just always had that camaraderie, which is really nice. But specifically for me, because I do want to highlight that because I did make the change to OBGYN so last minute, I was really prepared to, I guess, apply for pediatrics. I already had my personal statements, I had my letters of rec, and last minute, my last rotation, third year, which you're supposed to be applying soon for residency, I changed to OBGYN, and I could not thank enough the Office of Career Guidance for helping me switch all my rotations last minute, helped me get in contact with mentors to help me get letters of rec, help me get research. Everything they really, gave me so much guidance that if they didn't do that for me, I don't know if I would have matched into OBGYN that easily, to be honest. So the resources that SU gives, not just obviously the studying and everything, but to get you to where you want to be, is incredible. I can't speak highly enough. Not just studying, because they do have tutors on the island, and also mentors when you're on clinicals to help you, obviously get the grades and the scores that you need, but just day-to-day things like I said, getting a mentor, since I did switch careers so last minute.
Thank you, Pauline. That's an awesome story. And I think that does speak to what this group is all about, and what our, I know you mentioned the Office of Career Guidance. They're there for you every step of the way to help strategize for you the residency of your choice. And ultimately, that may come, as you're in first year and you're thinking, I definitely want OBGYN, but things may change, as you do these rotations, just like Pauline, when you do that OBGYN rotation, you might say, okay, you know what, this is where I want to be. I thought for sure I wanted surgery, but now, this is where I want to be for my life. And they're there to help you each and every step of the way, to help strategize, not only to navigate through year 4 and try to take on more elective rotations in that area, but also to ultimately give you the strategy to help prepare and apply for those residencies of your choice. And as Pauline mentioned, you're doing that during the 4th year because you're going to match in March of your final year. So it is a big part of that whole process, and you do have a lot of resources to help you through that entire process. So thank you for adding that, Pauline. I want to ask Shada the same question. Shada, obviously, just fresh off of this entire process, would you mind kind of walking us through what the residency process was like in trying to match into OBGYN, and also kind of what resources helped enable you to obtain that residency?
Yeah. So I think for me, kind of just to piggyback on what Pauline is saying, like a little bit, like the rotations can be important. So the good thing is that SGU has many hospitals that we're affiliated with, especially for me. I think Pauline and I both did our rotations in the Northeast. So if you do your rotations in the northern New Jersey, New York area, there's a high there's a high density of hospitals that we're affiliated with that are all relatively near each other. So it makes it very advantageous for you, because you can kind of put your eggs in a lot of different baskets by doing multiple like electives or sub-Is, which are basically they're sub internships, where it's an audition rotation. You're basically there to kind of show this program, hey, like, I can do this job. I can be an intern here next year. This is how hard I'm working. This is my personality. And basically you're giving them like a 30-day interview instead of like a 1-day interview. So I definitely took advantage of that. And I think ultimately that helped me a lot, because it's good in the sense that not only do you get an idea of like what this program is, like 1 day is very hard sometimes to gauge like what you're really going to get, which is, the entire residency process, but it gives you a leg up. And I think it's especially helpful for SGU students, because many of us do our rotations in the Northeast. So we have access to this. So regardless of what specialty you're interested in, you have this like network of all these different hospitals that, that you can go to and rotate at without necessarily having to move around frequently. So I think that was really helpful for me personally.
Awesome. Thank you, Shada. Shada, I want to throw another question your way. We had a question that came into the Q&A relative to the level of difficulty, not only in matching with a residency in the state of New York, but also obtaining clinical rotations in the state of New York. Would you mind kind of talking through how that process works and how you apply for which rotations you're interested in? And then ultimately, how the residency process works as well?
Yeah, absolutely. So basically what happens is your last semester on the island, there's like a little online link that they send you to fill out, and you basically rank the locations you want to be at, if there's a specific hospital, and there's even an area where you can kind of type in like, let's say you have family or a significant other or some kind of circumstance that, really makes you need to be in that area. You can put all of that down. They'll have that information. And honestly, they try to do the best that they can to place you where you want to be. And I think most people essentially get where they want to be. It may not be the exact hospital if you were really specific about something, but if you wanted like Brooklyn, like you probably got Brooklyn. If you wanted New Jersey, you probably got New Jersey. So that was pretty simple. And that's just for third year. And then fourth year is completely your decision. So you can go to any of the hospitals that we have in our network. And also you can do some out of network ones too, if you want to set that up on your own. But all the ones that are in network, it's completely up to you. And like you decide like whatever you're interested in. You can, whether it's a specific specialty you want more rotations of, or if there's a specific area, or you want to hop around, you want to do half the year in New York, half the year in Miami, you can totally do that.
Awesome. Thank you so much. I appreciate it. So obviously you got a little bit of a peek into how that would get you set up for residency. As Shada mentioned before, doing these clinical rotations is not just a 1-day interview. Now you have this opportunity of 30 days of interview-like experience environment where they get to see you each and every day, what your work ethic is like, and what kind of commitment you have to the field, to the rotation, to the hospital. And that's a big part of this whole entire process and of obtaining the residency of your choice. So just so you know, those of you that are really interested in OBGYN, we had 31 students in 2020 match into OBGYN residencies. So obviously competitive, and Shada was one of those 31 that matched in 2020. So now I want to kind of take a little bit of a peek on the other side of the curtain, which is as reviewing candidates for residency. And I want to call on Chima here. Chima, if you wouldn't mind, can you kind of give us a little bit of insight into, as someone who's been through the process on the other side of things and interviewed candidates, can you kind of talk to the idea of what you're looking for in candidates and ultimately what the residency process is looking like from the other side, from someone who's interviewing?
Sure. So, I mean, essentially, you have to treat the interview as you would any job interview. And what I mean by that is your interview starts the moment you walk on the premises. As soon as you park your car, assume your interview has started. I say that because you don't know who's who, and there've been candidates, not SGU candidates, but things that have happened. Somebody came in and maybe didn't hold the elevator or they didn't say good morning. Things that you don't think are as important and very trivial get picked up on because this random person will notice that, say nothing, and then they walk in an office, and then 2 minutes later you're the one who walks in their room to get interviewed. Life is funny like that. So I always have told candidates, because someone gave me that very pertinent advice when I interviewed, and I will never forget it because my interview process 7-8 years ago, it was a snowstorm in New York. I'll never forget it. I drove essentially 4 miles an hour to get to the hospital. I got there late, 20 minutes late. I had my Ugg boots on and my heels in my purse because I didn't want to slip and fall. And in my rush, because I already knew I was late, I walked in there with my Uggs and everything, apologizing to everybody. I'm so sorry, I'm so sorry. And literally they were like, oh, you're Chima, you're next. I walked into the interview room in my Ugg boots. I will never forget it. And then we toured the hospital in my Ugg boots. And I apologized to every single, I'm so sorry. I'm so sorry. It was the snow. And they all thought it was funny. And that's what they remember me as, the candidate that came in Ugg boots. But I wasn't, I was pleasant about it. I recognized that I was, at fault. And yes, it was weather condition, but I probably should have planned better. So think of the interview as anybody's interviewing you: the janitor, the secretary, the person who answers the phone when you're calling because you're lost or trying to figure out where to go, the person who directs you is which floor to go to. Everybody's involved. Whether they're not, treat them like they all are. Always be pleasant. Obviously, put your best foot forward. Little things matter. I mean, now with the era of masks, it may be a lot easier, but then if they're interviewing you on Zoom, there's only so much you can hide without a mask on Zoom. Keep a smile on your face. Your muscles are going to hurt for the rest of the day, but keep a smile at all times. You're going to get thrown off with questions they ask you. A lot of times, the questions are not necessarily to gauge you, so to speak. It's more so to hear how you think and how you process. A mistake candidates make is when they get into that trap of being asked medical questions. And I don't know why, interviewees ask that. I wouldn't ask somebody who's starting OBGYN how to throw an O'Leary stitch. You don't know how to do that. That's not my place to do that. But they will ask you that. Oh, what are the levels of the external sphincter or into whatever, the, pelvic floor muscles or whatever. Like, just say, you know what, I don't know, but I'll be more than happy to learn it when I get to your program. There's nothing wrong with that. The whole point of the interview is to get to know you as a person, and that should be at the forefront of your mind. What do you want these people to know about you that is not already on the paper staring in front of them? What people don't realize is the scores you have and your letters, for the programs that look at the letters, have already gotten you through a threshold to get to that interview. As soon as you walk in that door, however many of you that they interviewed for that day, you're all on the same playing field. Now you have to show them what makes you special, what makes you stand out. Why would you fit in with this group of OBGYNs? Why would you fit in with us? Are you teachable? Are you trainable? It sounds very mundane, but it is so important, because the smallest of things, the inkling of arrogance that comes off of you, not good. But you also don't want to come off too meek either. It's a very, very subtle line to walk. You have to show you're confident. You have to show you were trained. You went to a good medical school. You know what you're here for. You know what you want. The biggest lie people tell, we all told it, myself included, the programs that you know are not the programs that are your first fund. Like, you have your rank of programs where you want to go to, and you know the ones you really want, and you put your best foot forward there. But then the ones you're not so sure of, you're like, well, maybe I shouldn't. Don't ever do that. Every program should be treated like your number one program. They should not know that they're not your number one program. I don't care what anybody tells you. If they ask you how you rank in them, you say, I intend to rank you highly. You never give a number, because everybody tells that. We know you're playing the game. We're also playing the game too. So just put your best foot forward. It's not the place to be nervous, even though it happens. But come in there knowing that as much as we're interviewing you, you're interviewing us. Because we don't just want somebody who can fit with us. You need to know, can you fit with them? 4 years is a long time. And I say that because you're spending more time with all these people, your attendings, your co-residents, the nurses that you end up working with, you'll be spending more time with them than you will be your own family for the next 4 years. And it's not to scare you. That is residency training, especially OBGYN. They're long hours, they're grueling hours, but you will love every minute of it. So make sure you fit well with the group or the hospital that will be, so to speak, your extended family for the next 4 years and possibly for life, because a lot of people end up staying in the hospitals where they train in. All right. That's it.
I love it. Yeah, no, that's a great piece of advice I feel like that's a great piece of advice for anyone that's interviewing. And obviously it's a huge part of that process when it comes to residency, is making sure that it's a good fit for you, because ultimately, like you said, it's not just a year that it's not just a month. It's not just a couple. You're in that for the long haul. And that has to be a group that you're going to fit in with, gel with as you make your way forward. So I love that. And I think that's a really good piece of advice. Pauline, I want to come to you as well, as someone who's, been in the same situation of interviewing candidates and obviously going to be chief resident next year. Would you mind kind of talking through just your thoughts relative to how students can stand out for OBGYN? And also, I know there's always a lot of questions relative to the step one changing to pass fail. Would you mind kind of talking to how those things could correlate, and ultimately what you think about that potential change as well?
Yeah, sure. So in terms of the step one changing to pass fail, honestly, I don't think anyone has a particular idea of how that's going to play out, but I guess from talking with everybody else, we're thinking that probably step two scores might be held more regarded, like highly, something we look into. But in terms of like the exam scores themselves, they're kind of, I would say, a filter. Like each program obviously has their own like cutoff of like what score they accept. So if you were able to score higher than that, then your application kind of goes through. Otherwise, they may never even see your application. So that's why it's really important, even though like pass fail or step two scores, that you can score as best as you can so that you can make it past the filter so they can even look at your application. After that, it's kind of everything else. So what your letters of rec, so how you do well in your clinicals, you're going to ask for letters, a dean's letter as well. Personal statement can play a role. Also, any extracurriculars, if you do research projects, that can play a role. But honestly, after you get the interview invitation, everything's pretty much fair game. You're on like the same playing field as everybody else. Whether they're from a US med school, a foreign grad, they're all on the same playing field. And it's really about how you're gonna vibe with the program. And as Chima said, it's really, we're interviewing you, but you're also interviewing us. So like, you kind of have to pick and choose like who you think you're gonna get along with. Like the people behind me that I'm in the resident room, these are my family. And we're stuck with each other for 4 years. So it's really important that you get someone that is easy to talk to, can handle high stress, can take criticism and is willing to learn. Those are the things that we look for when we do the interview process.
Awesome. I love it. All right. So those were some great pieces of advice. I think if you were interested in OBGYN, I don't know how you aren't now, even more so interested in how you don't have some amazing notes to get started and start moving your way forward as you make your way through this amazing medical school journey. I want to remind our audiences here, not only here in Zoom, which we've been getting so many amazing questions here in Zoom, but also Facebook, YouTube. Please feel free to send questions our way. That's what we're here for. I know Darlisha is over there on our Facebook page, ready to answer questions relative to admissions as well as anything that you have for our panelists here tonight. I will be sharing those questions live as we make our way through, just as we are here in the Zoom platform as well. So please continue to send questions our way. I saw there's several people watching over on Facebook, so happy to have all of you there, and definitely don't hesitate to ask questions as well. I want to turn back to Chima here. Chima, if you wouldn't mind, given your current standing as a fellow in a, of course, very specialized area within OBGYN, would you mind kind of talking to the idea of specialized categories within OBGYN, some of the options that maybe you considered as you were going through that process of looking into fellowships, and ultimately how you landed on your specific one, MFM?
Sure. So deciding on fellowship for me was not as straightforward as I thought it would be. I always knew I wanted to be GYN before I went into med school. I actually wanted to be a GYN oncologist, was the main reason why I went into med school. Auntie of mine passed away from ovarian cancer, and that was my driving force for the fellowship. And then I started residency. With my training program, we didn't get as much exposure to oncology till about second year, like intense exposure. Like first year, you're doing more so rounding with your chiefs, and then second year, you get to do cases and work more with the oncologist. And that's when I realized it wasn't a good fit for me. However, the other side of things, which is maternal-fetal medicine, that everybody else, at least in my program, seems to shy away from. My year was the first year in, I think, 6 or 7 years that 2 candidates applied to MFM. Otherwise, no one's really interested in my hospital. A lot of us went into REI. I did my maternal-fetal medicine rotation as a second year, my hospital, and absolutely loved it. It was grueling. You're the only one who, runs the service and manages your patients. But I think what also got me into it was I'm a very hands-on learner. We didn't have fellows at the time. They now have a fellowship program there. I think they started 2 years ago. So a lot of the things we did with the attendings, your ultrasounds you're doing, the procedures you're doing, the counseling of the patients, the delivery of very, very premature babies that I never got a chance to do till I was about second year resident. All those things I was exposed to, literally open your mouth, hose, vomit, drink as much as you can type knowledge. And it was scary, but very amazing at the same time. We all go into medicine because we're lifelong learners. Anyone who is in medical field who doesn't feel that way, maybe they picked the wrong specialty or the wrong, field to be in. But I'm pretty sure we all went into it for that reason. Yeah, sometimes you want to cruise and just autopilot the things and not use half of your brain. Then other times you're I want to learn something else. And a lot of medicine is dynamic that way, especially OBGYN. The research industry with regards to research on pregnant women is lacking because it's not necessarily a population of people that researchers are comfortable dealing with. You're dealing with 2 patients here. So MFM for me was just, I missed internal medicine a lot. In the beginning, I said I went into OB because I liked surgery and I liked medicine together, and I couldn't decide. And I felt a specialty that combined both would be ideal for me, and OB did that. And then by the time chief year came along, you start to get more and more of these complicated cases, medical cases, and everything we had to defer to the MFM. And a part of it probably was ego on my part. Why can't I answer that question? Why can't I be the one to be deferred to? And, all the medicine we learned in medical school is applicable to pregnant women, but not quite, because again, the physiology is different. So I felt MFM gave me back that balance that I felt like I was missing. My initial fear was, the way a lot of subspecialists are now. You subspecialize and then you're stuck there. The joke in my hospital MFMs is there's a surgical emergency, you don't want an MFM in the room. It depends on where you train, right? So you have to take what you hear with a grain of salt, because at the end of the day, you make your career what you want it to be, right? I'm in a hospital where we have generalists and we have OBs and the MFM OBs, and we all do deliveries. We do the accreditors in my hospital, but that's not. So if you are somebody who went into OB and you felt towards the end, you want an MFM, and you felt the surgical side wasn't for you and you wanted to specialize, there is nothing wrong with that. You don't apologize for that. The other specialties there, I went into maternal-fetal medicine, which is what MFM is. There's 3 accredited fellowships, I believe. There's reproductive endocrinology, which is REI. Those are the people that deal with IVF, pregnancies, and that sort of thing. There's the urogynecologists that deal with pelvic floor, abnormalities and, women's urinary thing. That was never my forte. And then there's us, the maternal-fetal medicine, and those 3 are all accredited fellowships. By accredited, I mean they're ABOG, ACGME accredited. You finish them, you take board exams again for subspecialty. Outside from those, the other ones that are very popular, mixed, minimally invasive, which a lot of programs are actually taking, what's it called? A lot of OB generalists are going into it. So the Da Vinci robot. So anybody who's surgically inclined and likes to operate, which I thought about as well, because I did the OR. When I did laparoscopy, I was good at it. But again, I'm do I need 2 years to do robot training? That was my thought process. Some people do, Some others don't. I didn't think that was for me. But you don't need accreditation for that. I don't believe there's board exams, but there's talks about that changing, I feel. Probably in the next couple of years, they will get accredited and they'll start taking boards as well. And then if you're into adolescent GYN, so young girls who have like, menstrual irregularities or like, reproductive abnormalities of the sort or any of that, you can go into that genre as well. There's also women that deal with menopause. There's so many directions to go with OB that I wasn't aware of until I was about third, fourth year in training. So I would say to anyone, who's listening or tuned in who is interested in OB, if the focus of what you want isn't part of the 3 accredited fellowships, know that there's other ways to branch out. It doesn't have to be an accredited training. After I'm done with fellowship, I was thinking of going back into critical care, and apparently there are programs that take OBs in critical care. I did not know that. It's a 1-year training, and a couple of hospitals do that. If you wanted to do trauma, you can do that from an OB residency. Not accredited, but you can still do it. So there's lots of angles to go, depending on where you feel your career is going to take you. It's very different if you're going to practice in the United States versus if you plan on going back home. For me, home was Nigeria, and those are things I was thinking of. If I do ever want to go back, I don't want just what I learned in residency to be all that I have to help out. There's a lot of people who have medical abnormalities that, outside of being pregnant, maybe I can facilitate with my MFM training. That's how I saw it. So like keep an open mind with, whatever it is you feel your passion is with the subspecialty. And it's very evolving. Like things are growing every day. You'd be surprised where you'd land. You just got to start. And then take it from there.
I love it. Thank you, Chima. Chima, I want to come back your way because we had a question that was sent directly to you on Facebook. So AJ had asked relative to your experience within SGU in comparison to North American colleagues that are also doctors at your hospitals and your experiences that you've had. He wanted you to reference the ethics of SGU doctors in comparison to the ethics of North American physicians, and additionally wanted to ask relative to the stigma relative to Caribbean medical students. I know you talked about it earlier a little bit. Would you mind expanding on both of those things, what your thoughts might be?
So in terms of ethics, that's a very simple, but also not so simple question to answer. And I only say that because I'm thinking of the people that I trained with in medical school. Our population, at least our group, the 2014 class, were predominantly Americans. Like most of us were US citizens. I wasn't born here, but I naturalized here. And I felt I was lucky enough to have a group of colleagues that I would lay on the table for if they had to operate on me any day. Like that was the group of people that I was lucky enough to train with. So I'm speaking off of that. Compared to people that I work with now in my hospital, I don't think there's any difference with regards to the ethics. I think for me, and forgive me if this is offensive to anyone, the idea of being entitled is a very unique statement that I have heard people quote when they compare US grads to foreign grads. And the reason why I say that is every single one of us here did not get into St. George's because, whatever, they were not good enough. That's not the point. The volume of people applying to medical school today compared to the spots available, it just does not equate. I don't care who you talk to about that. The volume of residency spots available compared to students or residents or potential residents who want those spots also do not equate. You have a lot of amazing candidates across the aisle, both US and foreign grads, who would do beautiful work and amazing patient care, but just don't get the opportunity. SGU gets you that, at least on the medical school part. It's unfortunate they don't have residency program because I'm sure they'll take all of us and just give us spots to go do our training in. So the way I saw it, I applied to US school, I didn't get in. I applied to SGU and I got in and I took it and I ran with it. US grads are not any better than we are. I refuse to believe they are. I went through the same medical school they went through. I went through the same curriculum they went to. I passed the same courses. I graduated. I did my residency. I'm in fellowship. There is no difference. Once you're done with medical school, once you get in, not even once you get done medical, once you get in, you're on the same playing field. You just have to realize that you have to, whether you're a foreign grad or US grad, prove yourself to anybody that, look, I am equal to, if not better than these candidates. So that's my talk with regards to like the ethics. I don't think there's like any difference there. With regards to the stereotype or the stigma, unfortunately, that's something that still stands. It is not as bad as it was before, only because SGU has been around for so long, and I didn't know how long until I got into the school. And I started looking into it. I was like, oh, that's why when you say St. George's, people are like, oh, some lady told me St. George's in London. I was like, no, St. George's in Grenada. I was like, okay, well, we've made our name. We've been around long enough that we've made a name for ourselves. When you talk about Caribbean schools, not to be funny, SGU is the Harvard of the Caribbean. Let's just be real. You have Ross, you have AUA, you have Dominique, whatever other schools that are everywhere, sprouting in every island. They're everywhere. And I'm not saying that they're not good schools. I'm saying we've been there the longest and we've been vetted the longest. We're accredited, our veterinary school is accredited. Any program you go to where we have students that rotate through, or any residency program, I can guarantee you, in most parts of the country, you will find at least one person who came from SGU. That's how many doctors they pump out. I showed up in Miami thinking, went through the residency roster. I'm like, oh, of course, all US grads. And of course, there was an SGU student there, the SGU resident, third year resident there. Somehow we find our way in there, but that's just how we are. And if you don't know people there, somebody who sees the application, hopefully they're trained, they will be like, oh, that's my person, pull them in. It's that easy. So we're everywhere. We're plugged. You may not feel like we are, but we're everywhere. And the more years SGU gathers, been around for over 30 years. So think about that. A lot of those people who started the school back in the day are the ones who are program directors now, becoming chairmen in departments now. So you do have people in your corner, right? So it's not, you're not coming from a school where nobody knows the name of the school. You know, they haven't heard of your school. They must be under a rock somewhere. SGU has been around for a while. So the stigma is there, but it's not as bad as it was. I don't want to lie and say that it's not there, because it is. And there are institutions that will look at you for that reason. But trust and believe that they know the kind of students that are pumped out of this school, and they all begin to come around.
No, I think that's perfect. I think that was a big part. Now, we also had a couple questions relative to obtaining residencies, how to stand out. I know we talked a little bit about it before, but Shada, I'd love to come to you here to talk a little bit further about the potentials of how you can stand out relative to trying to obtain that residency. Obviously, you just fresh off of that, experience. Can you kind of talk us through that? Also, if you wouldn't mind, as someone who's obtained an MPH as well, could you talk us through if that is something that came up when you were doing interviews also?
Yeah, I mean, I'd say people definitely were curious about the MPH. And also for me, I think the main thing that I kind of want to hit with this is that you prepare for this from day one. It is the extracurriculars you're involved in, the research, anything that you do, even day one on the island, it's an experience that you have and you build off of. And if these are things that you're getting involved in that you really care about. And that's why I think the most important thing is, don't spread yourself too thin and sign up for every single club, because people are going to see right through that. But if you just pick a few things that you're truly passionate about and they speak to your character, they speak to your passion for the field. And even if you don't know what you're going to go into, like I didn't necessarily know that I for sure wanted OB. I thought it was something that I was maybe interested in, but it was definitely, I was never like, oh yeah, I'm gung-ho 100% going to be an OBGYN. I was very open-minded. And even though like I loved my first rotation, it was like a process of elimination. And I tried to give every specialty, a chance during my rotations. But even if it's not relevant or pertinent to the exact specialty you want to go into, it'll attest to your character, your interest, your commitment to the field and learning, whether it's research or your commitment to patient care and being involved in the community. So for me, like the MPH really played a role because it was something I was interested in, and it played a role with like the different extracurricular activities I was involved in on the island. So all of those things kind of helped me be able to form a great application, because there were things I could talk about both in the interview as well as like in my personal statement. So I think, as we're talking about this, like, oh, you need strong letters of recommendation, or, oh, you need a strong personal statement. But those things really start from the first day that you get there with what you choose to spend your time in. And I think that's really important to keep in mind, especially for prospective students, because this sounds so far away. You're like, oh, that's like 4 years from now. But really it starts from day one.
Awesome. Thank you, Shada. Pauline, I want to come to you here. If you wouldn't mind, would you be taking us through a day in the life of an OBGYN? Obviously, this year has been kind of turned upside down in comparison to probably what your years prior were like in residency. But would you mind kind of taking us through what a day is like? And, you know, I know you're there live in the room right now, so you're probably feeling it. Hopefully there's no colleagues that are walking around and, you know, listening to your answers here. But if you wouldn't mind kind of talking us through a day in the life of an OBGYN.
Sure. Definitely different this year, but in general, I think you kind of signed out for no sleep. So it's pretty busy on most days, I would say. What you're doing really depends on the rotation that you're on and also on the year that you're on. But in general, you wake up pretty early because we're, I guess, surgical residency. So there's a reputation that the surgical residents wake up at the crack of dawn, which is pretty true. We get here early and we basically round on our patients before you sign out or before your cases, depending if you're on labor and delivery or you're on GYN or something like that. And then you meet up with your team, you present your patients that you rounded on, and you kind of make up with the plan for the day, like what you wanted to get done for that patient. So if they're being induced, you know, the plan of care for that patient, or if you're on GYN, like what if they need scans, if they need to change their medications, whatever they need for their treatment. And then at my institution specifically, you do have a lot of autonomy and you really play an active role in your patient's care. So you kind of are the ones kind of making the decisions, doing the actual care. If there's a procedure, you're the one who's doing it. As an intern, like the first year, you are the direct person to see consults, triages, you get vaginal deliveries right away, and even the interns also get C-sections. And for all those cases that I've talked about, whether it's C-sections, vaginal deliveries, surgeries, like GYN surgeries, you're pretty much the main surgeon. So you get pretty hands-on. It's very interesting because things kind of change depending on your rotation, but it's kind of great because you kind of get a mix of everything. But it's in general, it's very exhausting. Like I said, you kind of pick a specialty that requires like very little sleep, but it's very rewarding. And then throughout the week, depending on, I guess, your year, you also have your continuity clinic, which is awesome because you get to see the patients that you picked up, whether you say an ER consult or if they're just establishing care, and you get to see them every week. And that's pretty much it.
Awesome. Thank you, Pauline. Yeah, I think that's perfect. And I like that that response there. I'd love to turn to Shada. Shada, if you wouldn't mind, same idea as someone who's only experienced OBGYN during these, you know, crazy times. Would you mind kind of talking to your day in the life of an OBGYN resident?
Yeah, so like Pauline says, you definitely wake up at the crack of dawn. At my program, the first years are responsible for seeing all of the postpartum patients. So your postpartum rounds can get very busy depending on how many patients there are, and also like how many of your residents are there. So if someone's on night float, then you know you're going to have less people rounding on the patient. So all those things kind of contribute to like how early you're waking up to go round on your patients. And same idea, you round on your patients and then you sign out. And again, you go over all of the patients, their plan, like if there's a postpartum patient that's preeclamptic, like when, you know, just all the different things, you kind of review any high risk patients. Then after that, you know, there's a sign out of like all the laboring patients, and then you kind of manage them. And then, like she said, like it's very hands-on, like you're there, you're, you know, doing the vaginal deliveries, you're there for the C-sections, and especially the primary C-sections, that's, you know, you and the attending. And again, the more complicated ones, you have like more help and seniors will come as well, but it's very busy. Things can change. One minute you think, oh, it's fine, you know, it's stable. All my patients, you know, their inductions have been started. They're only a couple centimeters. And the next thing you know, you have like a triage rolling in that's like fully dilated and you're just having a delivery and triage because that's our specialty. So you really just got to be quick on your feet and you really never know what the day is going to bring.
I love it. Yeah. So start to finish, up early, and you got to be ready for anything, which I think is a big part of being prepared for the field of medicine in general. You know, from the word go, term one of medicine, they say is like trying to drink from a fire hose. That's like the amount of information you're taking on in comparison to what you've done in the past. You're going to get hit from the beginning and you have to be ready to get right back up and continue to move forward, continue to trek forward and just continue to prepare yourself. Like many of our panelists were referencing earlier, you have to be, a lifelong self-learner, someone that really is passionate about medicine to be not only in medicine, but especially OBGYN. You have to be ready for anything. And I think that's a big part of what it's all about. Chima, I want to come to you here. I'm not gonna call relative to residency, but we had a question that came in relative to on Facebook, relative to fetal surgery. Would you mind kind of talking to your current role in maternal fetal medicine, what that represents, and kind of how that goes and what that would be referencing? They basically referenced if you would perform surgeries in that realm.
So yeah, that is a big misconception when you hear maternal fetal medicine. The assumption is that you are Addison from Grey's Anatomy or whatever that show is that I used to follow back in the day, or Arizona. No, that's not MFM. Maternal fetal medicine, as the name implies, is two components, maternal and the fetal side. For the maternal side, your fellowship trains you for that. Essentially, it's like residency, but with a lot less handholding. That's any fellowship you go into. It's all self-directed learning. The fetal side of things is more subspecialized. There's a very, very minute handful of programs in the country that actually offer fellowship for fetal surgery. And most of the candidates go through their fellowship in MFM and then go to do fetal surgery. And by fetal surgery, for the babies that have like, spinal bifidas, if they do those, surgical, like babies that have like congenital abnormalities that can be fixed in utero, so to speak. A lot of the fetal surgeons would do that with very teensy tiny laparoscopic instruments, but that is not the norm. I believe there's a program in Texas and there's another one, I think Johns Hopkins has one too. But most standard MFM programs are that, maternal fetal being managing the fetus in utero as best you can and doing, minute procedures like, pubs would do, like the chordocentesis if you have to transfuse a baby in utero. We do that. I did one recently, like maybe a month ago on a patient that just delivered. She actually called me today. And then, doing your amniocentesis, doing your CVS, like the typical things that you would expect an OBGYN to do. Those who do KCL injections, if that's your thing, you can do that as well. And then on the maternal side is obviously a lot of the medical complications with the maternal side, as well as the surgeries that go with it. Not all programs have their fellows do their CREDAs, but our agreement with our program was that the MFM fellow does it with the GYO fellows. And that's how we've been doing them, because whenever I finish, whether I decide to stay in my program or go elsewhere, I don't want to be the MFM that doesn't know how to operate. Like that would be the biggest, for me, embarrassment, because I came out of a program that did 8,000 to 10,000 deliveries a year. And I did C-sections in 15 minutes. I'm not about to graduate fellowship to take 2 hours to do a C-section. Like, no. But that's just me. So if that was something that you were interested in doing, it's a very small niche for the fetal side. You would have to start looking into those programs probably about the same time you're looking into the MFM fellowships as well, because it's very separate. Right now, I know my hospital, we used to have, I don't know how familiar, I know my colleagues here would know, Quintero used to work at University of Miami before he left. And so he had a fetal surgical center there, like the laser ablations on twins, he did those. And we're looking to recruit a new fetal surgeon. So what that would mean for us is that we at least get exposure to it. But it doesn't mean I graduate because I work with a fetal surgeon, I can go open my own fetal surgical center and start operating. No, you need to get surgically trained and go through the right program and that sort of thing. So if it's something you want to do, I would say best bet would be to look into a program that has both, if you can. And if you don't, the closest best bet is to get a regular MFM fellowship with somebody who does fetal surgery in your hospital. So at least you have some exposure to really be sure that this is something you want to do. Because again, it's not Addison Montgomery. This is the real world, right? If it's something that you really, really want to do, then you can seek out those programs. And for the people that do it, it's a very, very, very small cohort of people. You have to like research. There's no way around it. And liking research is not enough. You have to publish. You have to produce like legit, decent research. Like your name should be in papers and everybody else reads. You should be that person where your resume comes out and the first 2 pages are education and whatever else you've done, and the remaining 30 is publications. It's not to scare you, it's to give you the reality of how competitive it is. because now you're going in with a pool of candidates that are like the top of the top, people from like all the name schools you can think of going for the same positions you're going for. So you need to stand out. If that's something, it's not impossible. It's just, I never had interest in it. I thought I did, but they're too small and I don't have the heart. So it's like, it's just me, but it's pretty cool stuff they do. If it's something you think you can do, MFM suits me just fine.
Awesome. Thank you, Chima. I appreciate it. Chima, I'd love to come back to you for one more question here. We had a question that came into Zoom relative to how long your shifts typically are and how often do you work. Would you mind kind of referencing in your current fellowship what that kind of looks like on the week to week?
Sure. Like Dr. Pauline said, Gwen, it's, you start work at the crack of dawn and you go home when it's dark out. It's not always the same, not to scare you. It's a surgical specialty, so you should know what you're getting into. So we're all here to be realistic with you. You know, you're going into this because you love it. Don't go into it because residents were nice to you. That's the wrong reason to do OBGYN. Do it because you love it. But depending on the rotation that you're in, you know, for us, at least when we're in service, it's the most grueling for us. So typical, you know, we do 12-hour shifts. We start at 6:30. At least I go in at 6:30 round of my patients, and then 7:30 sign out, present to the attending, and after we're presented, then we all go around again. That's the only thing about MFM that I'm not too big of a fan of. It's a bit of internal medicine in the sense that rounding takes forever. And then when rounds are done, then you square your patients out and figure out what you need to get for them, those that need to be delivered, those that you can tuck away, yada, yada, yada. And then the rest of the day, depending on how it is, if you're buried in consult, you're buried in consults. But I look at it as every consult I see, if it's something I already know, okay, autopilot. If it's something I don't know, it's an opportunity to learn something, right? So we do that with the residents, and then, you know, whatever I'm not clear on, I would let the attending know. And whenever I've made a decision, I'm matter of fact telling the attending, this is what we did, da 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 da. Is there anything you want to add? And that's it. I was trained in residency as a self-directed learning in the sense that I'm not a medical student. Anybody can go and get a history on a patient and present it. When you start residency, the goal is to make you a physician. Get that information and do something with it, right? So you're not always going to be told what to do. And that was how I trained my interns back in the day. And that's how I am still going about it with my fellowship training. I would want to get a stab at it first. And if I don't know what to do, then you can fill in the blanks for me. Because you spoon feed me long enough, guess what? I'm just going to lay there fat and just say, keeps feeding me. And I'm never going to try to get my own food, so to speak. My program is essentially tailored that way. You know, it's very self-directed learning, and they kind of let us, you know, figure out the waters on our own. Outside of that in-service rotation, the other rotations like ultrasound, genetics, SGU, are not as grueling. Some rotations you come in at 8, you're done by 4. Ultrasound, for instance, is pretty regimented because the sonographers are not physicians. They have to go home to their families. We're the ones who signed up for this life to not have a life. So on those rotations, you know, it's very like structured. But for most people, I would say, at least in residency, in-service was pretty busy. And by in-service, I mean when you're covering the OB service, it's very structured. Either it's 10 or 12-hour days. GYN wasn't as bad for us, but GYO was, like oncology. That can also be quite demanding. So it's not always going to be that way the whole 4 years. Most programs are very good about designing your structure or your schedule in such a way that you have essentially ups and downs. You can't always be here. You will burn out. So, you know, 1 month is a horrible rotation. The next month you're on research chilling. The next month it's like not so bad. Next month you're on REI doing nothing. You know, it varies, right? So I wouldn't take it as it's go, go, go all the time. You will have moments of downtime. And then there are moments where you're even on the labor floor, nothing's happening. You're thinking something's wrong. Did they close the hospital doors? Every once in a while that will happen, but don't get too used to it. You know, it gets better. And then it's also program dependent too. My program I felt was a lot grueling just talking to my other colleagues that train at other places compared to others because we were very, very busy. I wouldn't change it for anything because I saw a lot and I felt like it made me a very comfortable attending to the point that when I was looking for jobs and they would give me, oh yeah, we do 2,500, 3,000 deliveries a year. I'm like, what am I doing the rest of my time? Because I'm used to, on my service, delivering 25, 30 babies per shift. That was the norm for me. I would have scheduled 7 C-sections a day and I'm done by 4 or 5 p.m. But that's my hospital. And then coming to fellowship here in Miami, we have about 5,000 deliveries a year. I remember the comment I made when I first started. yeah, I don't know how I'm going to do. I feel like it's not as busy. Oh my God, I regret it so much. It's not just about the numbers. It's also about the pathology of where you are. So New York is a good melting pot. Like I got to hose it, drink as much as you can, learn as much as you can. You learn to think on your feet, move, 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 operate like a good surgeon, do everything quickly. And then I get to Miami, it's like everybody here is sick. I literally, when you're getting a history on a patient and she tells you she's a para zero, any medical problem, no. The next question is, are you sure? Because we're not used to that. It's always a heart disease this, or SLE that, or baby congenital this. Like it's always something. Everybody has something here. So over time, I've learned to appreciate where I am here because I learned the basics where I trained and how to think on my feet. And now I'm learning the medicine that I really went in to do, which is MFM, because we have intense pathology here. So, think of it holistically. It's not just a numbers game. You should also look at it as where would get you the most. You're never going to learn everything. No place can offer you that. But you want to learn enough to know what you know and enough to know what you don't know to seek out the help when you need it.
Awesome. Thank you so much, Chima. So the questions here are slowing down. So I want to move to a live portion where we're just going to field live questions from our Facebook and Zoom platforms here. So please continue to send questions our way that you have for our panelists. We did get a question that came in. I'm going to, Shada, if you don't mind, I'm going to send it your way on Facebook from Maxwell relative to rural medicine. He asks, do you see rural medicine as an underserved segment of the population in the States?
Yeah, I mean, I think there's a huge need. That's why, there's a lot of places where, it's rural, there's a high demand, and they're willing to pay a lot more than somebody who's working as an attending, like an OBGYN physician in New York City, because there is a demand in rural areas for sure. So if you're interested in that, I think there's, a huge job market opportunity, as well as, a way to make an impact on a community that really needs it.
Awesome. Thank you so much. I want to ask Pauline here, if you don't mind. We just got a question relative to extracurricular activities during clinical rotations. Do you find those opportunities? Should you focus more on clinicals, especially since you're moving around different areas more? Obviously, you can stay in one place for clinical rotations, or you can jump around and experience different hospitals. But obviously, important part is finding that balance of other things in addition to rotations. Would you mind kind of talking to your experience with extracurricular activities and the things you did while you were in clinical rotations?
Sure. Clinicals is a little bit complicated, but I think it really depends on, I guess, what you're interested in. I think Shada had mentioned it, you don't want to spread yourself too thin, but you want to do things that you're actually passionate about. So if you feel passionate about something, then I say go for it. But you definitely, obviously clinicals and doing well in your exams are the most important. So as you can balance that, then I would say, yeah, go for it. Personally, I was all 4 years, I was involved with student government. And so I was president for my clinicals because that was something I personally loved. I just loved SGU. So I was always involved. So that's something I decided to spend my time with. Was it easy? No, because I guess it prepared me for this, where lots of sleepless nights of trying to make sure I got my work done, going to meetings. But those are the things that I was interested in. And so I made time for it. Same with research opportunities are always there, no matter if it, not even just OBGYN. So I personally didn't have too much OBGYN research opportunities because by the time I got there, it was the end of my third year, most of the projects were already hopped on by other students, but I was able to find research in breast because surgery was my first rotation. So I was able to hop on that. And again, that's also, individualized. It's whether or not you have the time and the commitment to do it, because if you don't want to have, like I said, the clinicals and doing well on your exam is still the most important. So it's up to you and how you feel, how involved you want to get with your other extracurriculars. It does help. If you do find something that you're interested in and you make time for it, it can make you stand out as a candidate. But if it's gonna make the other parts of your application suffer, don't do it.
Awesome. Thank you, Pauline. I appreciate it. All right. I want to send a very similar style question to Chima here. Chima, I know we talked a little bit about research earlier and how important it is for some of those specialized areas. But would you suggest research in the field of OBGYN early on? Would you suggest it in residency, all as much as you can? I'd love to hear kind of your take on research and how much or when people could prioritize that if they chose to do so.
So regards to research, I don't think it has to be specialty specific. I have to echo what Shada said. You have to keep an open mind going into medical school. I get it, we're all OBGYNs here, so it's a bit skewed with the conversation. And I knew I wanted to go into OBGYN. I'm an anomaly. It's not common. A lot of people go into medicine knowing, you know what, I want to give back. I want to be in medicine somehow. I don't know what specialty. I just know I want to do this. That should be your mindset. Get started somewhere. And then as you go and experience different specialties and interact with different physicians, something will speak to you wherever that specialty is. I always tell students not to do a specialty because people were nice to you in a rotation. I'm only saying this because medicine is one of those very rare career choices where when you pick a path, you're kind of stuck with it, if that makes sense. You can't go through residency OBGYN like all of us are here and we've all finished. And then Pauline decides tomorrow, you know what, this wasn't for me. I think I wanted to do ortho. Are you joking? She has to go back out, go back and do residency again if she gets it. And that, I mean, it's just a whole thing because, you know, every program has a set number of finite years that they look at from graduating med school into going into residency that nobody tells you about until you start. And I only know this from the other side of the interviewing process. You don't want to be out of med school for too long if you decide to take a path, because I see questions about MPH and such. So go in with an open mind. It's completely okay. And anyone who tells you that it's not, it's just, you know, that way, if you find something research-wise, you just dive right in. All they want to see is interest, really. As long as you express interest, and the interest mean you help them do the research. A little piece of advice I'll give on the side that you didn't hear me say formally is make sure you get your name on the paper you worked on. I don't care who you work with. If you gave your heart in and you helped them do it, they better pencil your name in there somewhere as one of the authors, because that is the only thing you have standing to say you were involved in this. If you don't have that, you could just be talking and say you're involved in research and we're looking at you like, well, it's not on your resume, right? I don't care what specialty it is. Ophthalmology, freaking podiatry, dermatology, whatever. If they're doing something you find interesting or don't find interesting, but you just want to learn from it, get involved. Nobody will fault you for it. It's all still publications under your name, right? And then when you find what speaks to you or a niche of yours that you feel like, you know what, this is where I want to focus on, by all means, go for it. But you wouldn't know until you start. So don't go focusing on just general surgery or just OB. It would limit you and it would limit those that you have the opportunity to work with. I don't think that would be a smart way to go around about it. All right.
I love that. Thank you, Chima. Yeah. And I think that's a great piece of advice in general. And I did want to get to that with you guys relative to what your pieces of advice are. So we're gonna answer a few more questions that are coming in here on our platforms, but then we will turn over to allow you to book appointments with our panelists. So for those of you that are not familiar with our Doctors on Call format, you actually have the opportunity to set up a one-on-one appointment with our phenomenal panelists here that are here for you and shared some time with you in the coming week. So please stay tuned for that. That's coming in just a little bit. But as we field a couple more questions, Shada, I know that there was a question directed your way relative to your MD and PH and what, you know, led you to pursuing that, and kind of a couple more questions relative to research. Would you mind kind of diving into that question? I think there's some people that are interested in the dual degree option and would love to hear a little bit further.
Yeah, no problem. So the MPH was something I was always interested in, and it was something I was considering doing, like if I didn't get into med school. So then when I saw that SGU had the dual degree option, I thought that that was a great opportunity to go ahead and do it and save time. So basically how it worked, it was that I went to Grenada a semester before I started like the medical school, and I did a semester of MPH coursework, and that was I think January of 2016. And then there was like an online portion we did in the summer, so I had like summer school as well, and then I had like I think a couple weeks off and before I started term 1 of the MD. And then so that basically took care of like the MPH coursework. And then since it's a dual degree, some of your med credits go towards the MPH as well. And then you also had additional work to do on top of it, like while you were pursuing your MD. So in my second year, I had to do like a capstone, which is basically like your thesis. So you write your paper and then you present it. And then I also had a practicum, which is basically kind of like a public health related internship. So it could be research, it could be a lot of different things. It's kind of what you want to do with it. And so I did that basically during my winter break. And I think it was summer after I took step 1 before clinical rotations. I like fulfilled those hours. There's also different ways to do it. You could do that while you're on the island. You could do a couple hours a week, find something that you're interested in. So it's really kind of up to you, but that's kind of how it worked. So it was nice because it was only really like a semester and a summer of extra work, and then I got an extra degree out of it. But it goes back to your interest. It needs to be something that you're interested in. And so for me, it was good because it was helpful for me to talk about in interviews as well as something I'll, use in real life.
Awesome. Thank you so much, Shada. I want to come to you, Pauline, for this next one. So we had a couple questions relative to research, not only from an undergrad perspective, applying to medical school, but also from a medical school perspective, applying to residencies. Would you mind kind of talking through the necessities of that, when it becomes available to you, maybe through SGU or within clinical rotations, within residency programs, as you make your way forward as well?
Sure, it's a convoluted questions, but we'll start with undergrad research. So undergrad research, I personally did 2 projects. If it's something that you're interested in, I don't think it's like a real requirement, but if it is something you're interested in, it should be available at your undergrad. How I got into it is I emailed one of my professors and asked them, I think I like looked them up on their like website to see like what research they were like currently doing. And then I emailed, I was like, hey, I'm interested in research. Is it okay if I like come and speak with you and see if there's anything I could do to help out? So that's how I got into it in undergrad. So if that's something that interests you, you can try that at your undergrad institution. In terms of SGU, there's actually a couple of ways to get involved when you're in medical school for research. On the island, there's a couple of professors that do research that you can, I emailed our genetics professor. So that I got into research pretty early on in my first year, since I knew I didn't really know, I thought I wanted to do pediatrics, but I figured it would be helpful, and I was already doing research in undergrad, so I had that experience. And I believe there was also, I remember there being a meeting like my second year, there was like, you can fill out like, if you're interested in research, like a survey, and then the people would reach out to you to see like what opportunities were available on the island. So I know a lot of my fellows, like, co-students got into research that way. And then clinicals, personally, that's when the bulk of my research came into play. A lot of the residents, like my residency in particular, each resident has to complete a research project or before they graduate. So, and trust me, we want help. So when you do your clinical rotations and your whatever specialty that you're interested in, or even if you heard like, from listening to the residents talk like, oh, that sounds interesting, I could see myself like helping out with that, because I wasn't interested in breast necessarily, but I was interested in the attending. I thought the research project was interesting. So I emailed her. I was like, hey, I heard you talking about breast research on DCIS. Is there any way I can get involved? And just emailing, like basically just reaching out to anybody, I guess, top to bottom, undergrad, med school, and then even residency, again, you can get involved. For resident research, it's a little bit complicated. Like I said, our program requires that you do a research project before you graduate, at least one. And you kind of have to just pick a project that you're passionate about, whether it's GYN, OB, whatever. And it's not really, you get a mentor at our institution and they kind of help you put together a project. You submit to IRB and all that, but I think that's a little bit complicated for the session. But in general, undergrad, if you're interested in research, reach out. There's always a project going on, and I'm sure somebody will be very, very, very thankful for your help.
Awesome. Thank you, Pauline. I appreciate it. All right. So I want to get to all of your last pieces of advice before we give the opportunity for them to make appointments with you in the coming week. Let me start with Chima. Chima, I know you've given a lot of amazing advice throughout tonight's session that many of our panelists, many of our attendees are probably jotting down, and they probably have a full page of notes now at this point and they're ready to go. But what would be your last bit of advice for these students as they get ready for medical school and potentially OBGYN in the future?
Oh, Lord. I don't know. I mean, I think I've kind of already said it all if OBGYN is where they want to go, but I'll start with the advice for medical school is just keep an open mind for starters. A lot of people are worried about, reading through messages here, GPA requirements, MCAT requirements, those sort of things. Nothing worth doing ever comes easy. I know there may be some people in your life who you feel they blink and the sky opens and the sun comes out and, money falls in their path or whatever. There are people who just have that kind of luck. It's rare. Most of us had to grunge and struggle and fight for everything that we've earned up until this point. So if you want it, go for it. If you want it, you have to give it your all. You cannot afford to be distracted. You just have to have that one single goal in your mind. Medical school is what you want, go for it. Having a life, extracurricular activities, those are all good and dandy, and they're very healthy components to being a normal human, because a lot of us doctors are a little weird. It's good to be balanced, but as you're doing your balancing, still have your ultimate goal in front of you. If this is what you want, break your back and go get it, right? If OB is what you want, that will come along the path. Just, surround yourself with the right people, through your rotations. There's all these amazing physicians you see here. You never know, you may run into them as attendings when you are at that point. And, they may not remember you, but they would be the ones to guide you when you get there. And if it's not them, it could be anybody else. I'm yet to meet anyone who I went to for advice when I was coming up, and I'm still coming up, reached out to as a mentor, as a medical student, or as a resident, or now as a fellow, that turned me away. A lot of people are willing to help you and in your corner, whether they're SGU or not. You just have to reach out. As a matter of fact, I had somebody reach out to me based on a paper that I wrote. I didn't know email addresses were included there. And I've been communicating with this individual for the last 2 years. I thought that was genius, but it's not something I ever thought to do, but people do that. So reach out however way you can. Don't ever be afraid to, because the most they're going to tell you is what? No, if they decide not to help you. You have nothing to lose, but you have a lot to lose if you don't try. And then just hopefully, fingers crossed, success for everybody if this is where you want to go.
Thanks so much, Chima. Yeah, I think that's a big part of it all. You really got to put your best foot forward and keep trying. And you can't get somewhere if you don't try to get there. And I think that is a big piece. And like I said before, you've given a lot of good tidbits throughout the night, and that was a great summary of all of it. It's just making sure if you're going to put in the time, if you're going to be committed, you're going to get there. And little by little, you just got to put in that effort to get to that final goal, whatever that may be, no matter what specialty you're in. So I want to turn to Pauline here. Pauline, same question. What would be your last piece of advice for this group?
Oh, wow. Chima said like most of it, which is, working really hard, putting yourself out there. But I do want to just highlight, just enjoy the ride, because especially if you do go to SGU, like the memories there are unforgettable. People go there and, you're always like wound up, like, I need to get a certain GPA, I need to do this test score. And we get so focused on our goals, but we forget to really enjoy the moment. Like I for one miss the island. Like the time I had there was unforgettable. And I speak for everyone because everybody I've known that's been to SGU feels the same way. So don't forget to kind of stop and just enjoy yourself while you're trying to, you know, achieve your dream. And you know, the friendships and the memories you make will last forever. Like there's nothing that can compare to the family and the friends that you make at SGU, like nothing. So that's my advice for you.
I love it, Pauline. Thank you. I can attest for all of the alumni that have said many of the same things that you just mentioned, and a lot of the same ideas, from, you know, a grad that said that they go to 9 countries and have a place to stay. Like, what kind of environment? There's not many places in the world where you can get that kind of experience. And I think that's what it's really all about. You're getting this crazy, amazing culture and experience throughout your entire SGU life. And I think that that's what it's all about. Pauline, I'm going to come back to you for one more question that just came into Facebook, relative to the financial side of things. You know, obviously the cost of medical school is expensive. Would you still do everything the same way as you did? Was this, you know, financial struggle or the idea of the finances, was that anything that came into play for you?
Oh yeah, I mean, finances, when you talk about in medical school in general, is a convoluted question, right? It's going to be expensive. But would I do it again? 100%, because I'm here now and I'm doing what I love. So it was worth it in the end. But in terms, if you're like really worried about finances, there's loans. I would talk to the school. There's a lot of advisors that can help you find scholarships, loans that can get you the funding and the means to get to where you want to be. So if this is something you want, there are ways to get it.
Awesome. Thank you, Pauline. Yeah, there are so many resources. We do have financial aid counselors who are available to help you through that entire process, can help support you through it all and help to budget as you make your way through too. I know there's a lot that's going to be on your plate, a lot of things to manage time-wise. Don't worry. There's resources every single step of the way to help you, from the first day to the financial side, to the, you know, clinical, you know, student support when you're down there on campus, getting you that small group training and learning, to, you know, in residency, as we talked about before, from Office of Career Guidance and beyond. That's what it's all about. We want to help you each and every step to get you to that ultimate goal. Shada, I want to send it your way. What's one last piece of advice for this group? I know there's a lot of great advice already. They probably took almost everything from you, but what would you like to add?
I mean, I guess Pauline kind of took mine. I totally agree. Like Grenada, those are like literally the best year, like 2 of the best years of my life. Like I had so much fun. I made the best friends. Like we all still talk, like our group chats, especially now, like about residency. And like, you know, even though now we're, you know, in different parts of the country, like pursuing our residencies, you know, those are friends and, well, they're family, you know, at this point. So I think, you know, obviously you're going to work hard, but don't forget to like enjoy where you're at, like the place as well as the people, because these are the people that are going to support you through like your really hard days, even when you're like thousands of miles away. So just work hard, have fun, and, you know, one day at a time.
Awesome. Thank you so much, Shada. All right, so I want to turn to the great part of our Doctors on Call events, which is offering up those opportunities for appointments. So I'm going to give it back to Erin now, but I want to just once again thank our amazing panelists for this evening. They were awesome. Appreciate seeing all of you and hearing your wonderful perspectives relative to OBGYN. So thank you so much for your time. And Erin, thanks so much, and take it away.
Thank you, Joe. And thank you again to all of our amazing panelists. And thank you to all of you for attending with us today. We hope you found this session to be useful and informative. We hope that you learned a lot about your future career and also your future experience at SGU. As Joe mentioned, you do have the opportunity to sign up for one-on-one sessions with our panelists, our fantastic panelists from today. There's a QR code on the screen. If you just snap a picture of that. You can go online and you can sign up for one of their interview or one of their time slots to have a one-on-one session with them. I also wanted to mention to you all some of the upcoming sessions that we have online. Some of them are just general information session, but we also have a couple more doctors on call sessions that I think you all will be interested in. In terms of upcoming regular information sessions, we have an information session on March 1st. That's next Monday at 6 p.m. We also have, since I know we have some international folks who are on the session today, we have some special international sessions that you might be interested in. First, this is literally tomorrow morning at 8 a.m. Eastern Standard Time. So if you want to stay up late or you want to get up early, you can take advantage of that. It's how to become a doctor in the US. So that's all for our international attendees who hope to practice medicine in the United States by attending SGU or another US medical school. And also, I know that we have some folks here that have joined us from African countries, at least I hope you're still here. We have one session specifically for students in Africa. That's going to be next Tuesday on March 2nd. That's going to be at 11 a.m. Eastern Standard Time or 5 p.m. Western African time. And that is specifically about entry for the April 2021 term. That's our next term that's coming up. If you are an African student and you're interested in enrolling in April, you should definitely join us for that session. Also, we have 2 more doctors on call sessions that are coming up that I think you all might be interested in. This Thursday, so that's in a couple days from now, again at 8 p.m. Eastern Standard Time, so the same time as today, we have SGU doctors on the New York COVID frontline. So you're going to be talking with doctors, SGU grads who are practicing in New York and have been dealing with the COVID epidemic. Also, for a lot of you, I think you'll be interested in, on Wednesday, March 3rd, again at 8 p.m. Eastern Standard Time, we have Women in Medicine. So we have a number of SGU female graduates and what it's like to be a woman working in medicine. So, and oh, I just checked online. It looks like we have a lot of those slots for those one-on-one sessions are filling up. So definitely make sure that you take a picture of that QR code and you sign up before they're all gone. And again, thank you all for joining us today. We're going to leave the Q&A open just for another minute in case anyone has any last minute questions. Otherwise, we hope that you found the session useful, and thanks again for joining us. And we hope that you all have a great evening.